Hello there. Today I will be talking about a disease that males will most likely encounter during their lifetime: benign prostatic hyperplasia. What is benign prostatic hyperplasia? Before we go into the disease, I will discuss related topics that will make understanding this specific disease easier. First of all, what is the prostate? The prostate is a small gland that encircles the urethra just below the bladder. Its main role is mainly during reproduction, but can affect the urinary system when it enlarges. Think of it as a rubber band around a hose. As the rubber band gets tighter, it squeezes the hose, preventing water from flowing through. This can be said the same for benign prostatic hyperplasia. How does it enlarge, you might ask? Well, any tissue in the body can undergo abnormal growth, which can be due to injury, genetics, or various external factors. In this scenario, the abnormal growth or enlargement of the prostate is due to a process called hyperplasia. Hyperplasia is a form of cellular adaptation that causes an increase in the number of cells, thus causing the tissue to grow. Now, benign prostatic hyperplasia specifically refers to the growth of the prostate. This is a common prostatic disease that affects 44% of men aged 40 to 59 years and affects at least 70% of men over the age of 80. Remember the analogy I said earlier about the rubber band and the hose? Well, in the case of benign prostatic hyperplasia, the enlargement of the prostate constricts the urethra, which could produce different and painful symptoms. This can cause pain or difficulty when urinating, frequent urination, or incomplete bladder emptying. This can lead to further complications such as urinary tract infections, bladder stone, or even kidney damage. It sounds bad, right? But luckily, there are treatments and ways to manage BPH. When you have been diagnosed with an enlarged prostate but does not display any symptoms yet, you can take lifestyle changes that can prevent the condition from worsening. You can do the following. Drink fewer liquids, particularly before you go out in public or go to bed. Avoid or limit alcohol and caffeine. Be physically active. Empty your bladder completely when you urinate. And lastly, use the restroom often and don't try to hold urine for long periods. Certain medications can also be prescribed by your doctor to help with your condition. They may prescribe alpha blockers that help relax muscles, making it easier to urinate. 5-alpha reductase inhibitors help stop the growth of or help shrink the prostate, improving the flow of urine. For severe cases, and as a last resort, surgery may be performed to help improve symptoms and quality of life. Transurethral resection of the prostate is a surgical procedure used to widen the prostatic urethra. And that's about everything what you need to know about benign prostatic hyperplasia, the unwanted growth spurt that no man asked for. But don't worry, with the right management, you can keep your flow in check and live life uninterrupted. Stay informed, stay healthy, and may your bladder always be half full, not half stuck. Thank you for listening.